Trauma patient care simulation using extended reality technology in the hybrid emergency room system. Corey ITO. Department of Emergency Medicine. Division of Acute Care Surgery. Tokyo University School of Medicine, Tokyo, Japan. Extended reality, XR, is a general term for virtual reality, VR, augmented reality, AR, and mixed reality, MR. Recently, the application of XR technology has expanded into medical science. For example, patients' 3D CT image can be turned into the hologram. Providers are able to view the 3D CT images stereoscopically by attaching MR wearable glasses, HoloLens, Microsoft. However, it is yet to be applied to the simulation of trauma patient care. Authors developed a simulation model of trauma patient care using XR technique involving multidisciplinary trauma resuscitation team. This video shows our first demonstration of the XR trauma patient care simulation in the hybrid emergency room system, HERS. The HERS is a novel trauma resuscitation room equipped with a CT scanner, fluoroscopy, and operating room setup. The author's institution installed the HERS in July 2017. The patient is brought into the HERS directly from the ambulance and moved to a carbon table. Once the patient's airway is adequately secured and breathing are assessed, the whole body CT scan can be performed during the primary survey. The order of primary survey in the HERS is called ABCTDE. Once the diagnoses of injuries were interpreted, damage control surgery and/or endovascular procedures under the fluoroscopy can be done simultaneously or subsequently by acute care surgeons and interventional radiologists, IRs, without transferring the patients to the operating room or the angiogram suite. This whole body CT scan was reconstructed into the 3D image. It revealed multiple rib fractures, bilateral lung contusion, hemothorax, liver injury, bilateral kidney injuries, middle colic artery injury, the fourth thoracic spine and the second lumbar spine burst fractures, and pelvic fracture. The 3D CT image was turned into the hologram by a medical image VR/MR automated application web service, HoloEyes XR. Providers are able to view the 3D CT images stereoscopically by attaching MR wearable glasses, HoloLens, Microsoft. To assist in spatial recognition of stereopsis, AR, and MR techniques was applied by superimposing the hologram on the mannequin during the simulation in the HERS. A simulation using XR technology based on an actual trauma patient was prepared. Three acute care surgeons including one trauma leader, 3 IRs, 2 emergency medicine physicians, nurses, and one radiology technician participated in the simulation. The briefing was performed based on the pre-hospital information. A scenario case was a 33 years female who fell from a 7-story building with GCS 9, BP unmeasurable, HR 96 BPM, RR 18/min, SpO2 84%, body temperature 35.9 Celsius. The decision was made to bring the patient to the HERS directly. The acute care surgery team and IR team were activated. The primary survey revealed the airway was patent in GCS 9. There were bruises over the right chest wall and right flank. The pelvis was unstable on palpation. A pelvic binder was applied. The initial vital signs were blood pressure 85/60, heart rate 120, respiration rate 20, and SpO2 97%. The whole body CT scan were performed as an adjunct of primary survey. It was converted into the hologram and superimposed on the mannequin. The team identified intraperitoneal hemorrhage with the extravasation of contrast from the disrupted middle colic artery and right renal vein, as well as pelvic fracture with retroperitoneal hematoma were identified. Arterial blood gas revealed metabolic acidosis with base excess -3.3 and lactic acid 5.3. The coagulation panel revealed coagulopathy. The decision was made to intubate the patient. Following the intubation, the blood pressure was down to 60s. The damage control surgery by the surgery team was followed. Liver packing, right nephrectomy, the ligation of middle colic artery, and pelvic packing were performed. Then, angioembolization for pelvic fracture were performed by IRs.
Dale.
After the completion of the damage control surgery and angioembolization, the patient was transferred to the ICU. The education point of this video is that XR technology can be applied for the trauma patient care simulation. In future, this technology could be extended to actual trauma patient care if clinicians become accustomed to practicing while wearing the holographic lens.